Hyperthyroidism is a condition, in which excessive production of thyroid hormones occurs by the thyroid gland. Graves' disease is the most common cause of hyperthyroidism. About 50 to 80% of cases of hyperthyroidism are caused by Graves' disease. This disease is 8 times more common in females than males and often occurs around 20 to 40 years of age. Basically, Graves' disease is an autoimmune disease, in which serum IgG antibodies bind to TSH receptors on the thyroid gland and lead to thyroid hormone production, that is, these antibodies act as thyroid-stimulating hormone. These antibodies are called thyroid-stimulating antibodies. Note that Graves' disease can be distinguished from other causes of hyperthyroidism by the following features. Like diffuse thyroid gland enlargement, ophthalmopathy, and pretibial myxedema. While other causes of hyperthyroidism include multinodular goiter, autonomously functioning solitary thyroid nodule, thyroiditis like subacute and postpartum thyroiditis. Drugs may be responsible for hyperthyroidism, such as amiodarone. Signs and symptoms of hyperthyroidism include palpitations, heat intolerance, irritability, increased perspiration, fine brittle hair, and muscular weakness which usually occurs in the upper arms and thighs. Furthermore, diarrhea, weight loss, amenorrhea, gynecomastia may be observed. Ocular manifestations include lid retraction, lid lag, chemosis, exophthalmos, ophthalmoplegia. Neurological manifestations include tremors, chorea, myopathy, and rarely periodic paralysis. If the disease is untreated, long-term hyperthyroidism can lead to osteoporosis. Now, we will talk how to diagnose this disease. Diagnosis. In hyperthyroidism, blood tests show a low thyroid-stimulating hormone and raised T3 or T4. Raised T3 is more sensitive for hyperthyroidism, as there are occasional cases of isolated T3 thyrotoxicosis. Checking radioiodine uptake by the thyroid gland by performing a thyroid scan, and thyroid-stimulating immunoglobulins may help to find the exact cause of hyperthyroidism. TSH receptor antibody levels are high in Graves' disease. While talking about thyroid radioactive iodine scan, you should remember, this is performed in a diagnosed case of thyrotoxicosis. Remember, high radioactive iodine uptake occurs in Graves' disease and toxic nodular goiter. On the other hand, uptake is low in conditions, like subacute thyroiditis. Now, we will discuss treatment. The following three are the treatment options. Antithyroid drugs, radioactive iodine, subtotal thyroidectomy. Antithyroid drugs include carbimazole and propylthiouracil. They are usually given to patients who are less than 40 years of age. Patient having small goiter and mild disease. These drugs reduce the synthesis of new thyroid hormones by inhibiting the iodination of tyrosine. A very high dose is often needed initially in the course of treatment, but the dose is adjusted in the subsequent visits. Titration of the dose is difficult sometimes. So, block and replace treatment may be adopted. In block and replace treatments, thyrostatics are given in sufficient doses to completely block thyroid hormones, and the patient is treated as though he has complete hypothyroidism. The block and replace regimen is continued for up to 18 months. It is believed with a block and replace regimen, there is no under and over treatment. Remember that relapse is observed in 50% of cases within 2 years of stopping these drugs. So in case of relapse, we should consider surgery and radioiodine. Beta blockers play an important role. Common symptoms of hyperthyroidism such as palpitations, tremors, and anxiety are caused by the sympathetic system. Hence, beta blockers provide rapid symptomatic control. Remember, beta blockers also decrease the peripheral conversion of T4 to T3. Radioiodine. It is indicated when the patient is above 40 years, or, if there is recurrence following surgery. But remember, patients with Graves' disease having moderate or severe Graves' ophthalmopathy are cautioned against radioactive iodine treatment, as it can exacerbate already existing thyroid eye disease. Surgery. Subtotal thyroidectomy may be done if the patient has recurrent hyperthyroidism after a course of antithyroid drugs in patients less than 40 years, or a patient having a large goiter and severe hyperthyroidism. Although surgery is not commonly performed, because most common forms of hyperthyroidism are effectively treated by the radioactive iodine method, and there is also a risk of removing the parathyroid glands, and possible damage to the recurrent laryngeal nerve. Like and subscribe to our channel for the next coming videos.